COPD. Respiratory conditions like this are the third biggest killer in the UK. Dr. Poonam, what actually is it?
Yeah, a very common and very serious set of lung conditions. Something that I see a lot in general practice, particularly in the winter months. At this time of year, people are prone to having lots of flare-ups. So with COPD, if we go back to the anatomy of the lungs, so in our lungs we've got airways. These are long, narrow tubes, and through that very easily we can move air in and out of the body. However, one of the biggest causes of COPD is smoking. So through damage over the years to the insides of these tubes, it causes inflammation, it causes swelling. You can end up with quite a lot of thick mucus as well. So you can imagine these become really quite narrowed and tight. So it makes breathing very difficult. So people can experience shortness of breath. They can have a cough that can be persistent. It can also be quite productive. So in that, you're bringing up a lot of phlegm, can cause a lot of wheeziness as well. And the thing that people often don't appreciate is that actually with things like COPD, it increases your risk of other conditions like heart disease and lung cancers. So very serious.
Very serious stuff. You've brought a device in with you today, and it works with AI to try and establish whether something is COPD.
Yeah. So if I actually talk about what happens if you, for example, have related to these symptoms, or you were to go and see your GP, we would do various things. We would examine you, we would send you probably for an X-ray and some bloods, but the definitive test at the moment for COPD is something called spirometry. So some practices have this in-house, some would refer you to an outpatient clinic, and it involves a device where you are breathing in and then you're blowing out as hard and as fast as you can, and it's measuring your lung capacity. But for a lot of people that have severe breathing difficulties,
that would hurt,
it can be quite uncomfortable. Yeah. So this is where this new device is currently being piloted, and it is driven by AI technology, and it's shown incredible results in some of the studies, up to 91% accuracy in being able to diagnose COPD on the spot. It's a lot more comfortable and easy to do. And if this is successful in the pilot, it could get rolled out to GP practices. So, for example, I could assess somebody, promptly do the test and start treatment rather than the long waiting list.
Wow, yeah, it would take much less time.
So who gets affected by this? I mean, because you get the feeling that people, when they're older, but I know a young man who's 22 who has this.
Yeah.
So is it all ages?
So it's a great question, because actually COPD can affect anyone at any stage. We have said that the commonest cause of COPD is smoking, but that's not the only cause. So there are things like if you live in areas where there's high air pollution, if you work in a job, for example, where you're working alongside dust or fumes or chemicals, there are also genetic conditions as well. So although it is common in those over the age of 35, it can affect anyone. But really, if you have had a cough at any stage that is persisting, it's been there for 3 weeks or more, you really should go to your GP and get that checked out, because it could be a number of different things, including COPD.
Yeah, we just saw earlier the signs there of COPD and what can affect it. What does it look like if you are living with COPD, and how do you ease those symptoms?
COPD, the symptoms can vary very much, but it can be a very debilitating condition to have. And people with COPD are vulnerable. Their chests are vulnerable. They are more likely to have these flare-ups, what we call acute exacerbations. And at this time of year where there's lots of viral illnesses circulating, that's the time where you can really have it hit your chest. So things that you can do is, if you know that somebody, I mean, COVID is rife at the moment. We're seeing lots of cases of that, flu season. If you know somebody showing symptoms, you've got COPD, keep away from them. It can be hard, especially if you've got grandchildren, but really that's protecting you. Alongside vaccines.
Yeah, get vaccinated.
You know, get yourself protected. It's just not worth it. So the flu jab, COVID boosters if you're eligible. The other thing is always make sure that you've got your inhalers to hand. You know, you don't want them sitting at home when you're outside. That's really good advice. Because it can strike at any point and symptoms deteriorate really quickly. So always have a spare pair, carry them on holidays. Make sure that if you have got rescue medications, some people will be prescribed antibiotics and steroids as just-in-case medications. Have them to hand. The last thing I'm going to say is the exercises. So it's particularly pulmonary rehabilitation, widely available on the NHS. Your GP can refer you. These are specialist individualised exercises that a physiotherapist would take you through a course of 6 to 8 weeks. And that's really to help strengthen the chest and to help improve your breathing.
This is important as anything, that, isn't it?
Yeah.
Lovely. Thanks, P.
Thank you.
Exercise always key. Our next guest is a big believer in boosting mental and physical health by embracing the great outdoors too.
In the latest series of BBC show Gone Fishing, presenter and comedian and actor Paul Whitehouse and co-host Bob Mortimer talk about how a rod and a reel have helped them change their mindset. I'm so excited to speak to them, I can't speak. Mindset for the better.
When you asked me to go fishing, Paul, yeah, and I was a bit reluctant, let's be honest.
When?
After I'd had my operation.
Oh, going back all those years?
Yeah, I was just thinking, though, at some point, I said yes, yeah? And because of that, my life has changed. I now have these lovely fishing trips. As you get older, you say no more. Would you like to do this? Would you like to come round to this? Would you like to go to this? You increasingly say no, and you end up on your own.
Yeah, there's a lot in recent years, the power of no, isn't it?
Yeah.
But you've turned it around.
Well, I just think it is like a little path.